Collaboration means to me teamwork. Everybody works together and we get a big job done. And, you know, everybody puts their 2 cents in to get the job done.
Well, she's very friendly and helpful, and she's very helpful because we need a lot of supplies at palliative care, and I really can't think of anything that she's not doing. She's like doing more than she has to.
Without communication and talking with people, nobody knows what the resident needs or what changes have to be done, and it just means that the residents get what they need when they need it.
And if she doesn't get the supply, how are we going to do, say, just a dressing? So her job is as important as everybody else equally. We shouldn't underestimate what she's doing.
I learned of the flood and how the roads were closed and how many of our staff couldn't get home. And I learned what an awesome job the team was doing, how they all pulled together as a team. They involved various parties, whether it be the municipality, they supported our neighboring partner in health.
Collaboration means to me is working together with your team for a common goal and trying to reach that goal as quickly and as efficiently as you can.
We're sort of cross-trained in more than one area so that I can go out and help in emerge if I need to, or go into the operating room.
So the collaboration between just not within our hospital, I think with Parks Canada, Alpine Helicopters, our relationship with the RCMP and keeping us informed on what they're doing, the town of Banff pitched in.
They will do what they need to do to get the job done, and they'll access the supports that they need to get the job done.
Bonnie collaborates with people all day, every day. She, in any given day, should be working with unions, frontline staff, our employees from every aspect of the organization, rural.
You just get what needs to be done and you do what you need to do, and pulling in people in the organization that are always, you know, there to support you so that you can do it. I mean, I look at my team, and really that's what's allowed me the opportunity to collaborate, is for the simple fact that the support that I have around me.
Again, one of the things Bonnie and her team has done over the last year is brought together all the diverse insurance and benefit plans that we have for our employees. So she's worked with employee groups, she's worked with the unions, she's worked with finance to bring together so that we have a more streamlined approach to insurance. She works with people outside of her department all day long.
Yeah, the Auxilians, I mean, this is a group that is unheard of. They gave us 6,000 volunteer hours. They gave us $50,000 worth of money to buy equipment with. And like, they've probably touched every patient, every staff member in the facility in one way, form, or other.
I just love it. Gail says the story. I like to volunteer and I enjoy working in the shop because we do work together very well. Because we work with long-term care. Anything they ask for, we somehow manage to find the money and come up with it.
They do it for the love of the community, the love of the facility, and the people they serve. In the last 10 years, we did a quick summary. They have given us over $250,000 worth of equipment. And they're always asking, hey, what else do you need? From a collaboration perspective, and the intertwine of a rope that cannot be broken.
Brenda demonstrates collaboration in her work with every task she takes on. Right from the start, it's always a team approach. Who can we pull in that this is their strength? How can we use other disciplines to enhance it? Everything she does is a team perspective.
I really believe that working as a team and collaborating as a team is what we need to do to provide the very best possible care to our residents that we serve here at the Edmonton General.
So some of the programs that Brenda has brought to 4Y into our facility are the Tai Chi program, which she's collaborated with the community to bring in. She brings in her family pet, so right there that tells you that she collaborates. She's brought in an elementary school to do an art show, which was a huge success with residents, families. Everything she does, it's always about how can we better serve the residents and make their lives more meaningful.
Also, the residents are bringing forward how they felt about CHRISTEY-ANN. They felt that CHRISTEY-ANN had empowered them for the first time ever in their stay here. One lady said in the 2 years she'd been here, she'd never felt like she had so much purpose. And that's because CHRISTEY-ANN was able to bring together more than just one mind to a problem. She was able to collaborate and work with the management team to come up with a solution to an issue. She was able to get a tuck shop going.
Well, I think when we are working together really well at St. Therese, the residents feel that, and they benefit when we can work together and this place runs smoothly.
Before CHRISTEY-ANN joined us, we did not have a viable tuck shop. She started the tuck shop program with several of our residents and has helped them to feel really important. And thanks to CHRISTEY-ANN, it has grown.
Collaboration every day is what we're all about. We couldn't work in isolation. Emergency disaster management is not an isolation kind of program. You can have all the kinds of plans in the world, but if you don't collaborate on them, they're only a plan on a piece of paper.
When the team gathers to respond, there's a calmness in the room, a preparation, and let's go to it. There's no panic, there's no indecision. Everybody knows what their job is and how they're going to go about doing that job.
And so every day it's about collaboration and finding that great final plan.
And it is about that collective will to always keep the patient and family first, keep everyone safe, and be innovative in design so that we continue to serve.
The food services team here at the KILLAM Health Centre definitely demonstrate collaboration in all that they do. You never hear the words can't or don't. We always hear how can we do it and when do you need it.
I demonstrate collaboration with communication with the rest of the staff, all the staff that's on duty that day, and we try to work together, figure out our diets, and get it done.
The Meals on Wheels program that runs out of here, we serve up a meal, and we have volunteer drivers that come in every day to deliver these meals.
And we host a Christmas party for all of the residents and their families, which is a meal for 200 extra people.
The thing that energizes me to get here in the morning is the residents. They are a great group of people. They have so many different personalities down there, and they're fun to be with.
Collaboration to me means working together as a team, no matter what department you work in, to come to a common goal or purpose to make the lives of the residents here better and the staff.
Of course, collaboration is really what makes this place run in a lot of respects. And seeing Kelly in that role and recognizing herself as a volunteer coordinator and is able to bring many different resources together to make one single project work in a very special way for the residents.
Last year in June, we had residents evacuated from Drumheller. They came to St. Mary's, so we had to make a makeshift unit. So there was administration, housekeeping, dietary. We all came together to make first floor, which is generally offices, into a fully functioning unit. I came down, I rounded up volunteers, got a TV, we had music, we had movies. It was amazing. It was a really good example of teamwork.
Leslie uses collaboration daily as she's working with the lab in the way that she has to arrange for her specimens to be transported from the Mary Immaculate Hospital to the Vegreville Hospital.
I feel I demonstrate collaboration in my daily work because I work directly with the doctors, directly with the nurses on long-term care, also with the lab staff at the Vegreville St. Joseph General Hospital.
She works with the doctors, she works with our long-term residents, she works with the outpatients that come in for the clinics.
Collaboration to me is a team effort that is put forth when you have a goal, and it takes numerous people in collaboration to make the goal work and to achieve that goal.
Melissa demonstrates collaboration throughout her practice. Everything she does within the hospital is for the benefit of the patients, and she understands how healthcare is really, really important to interact with others in order to get the best quality care you can.
Collaboration to me, simply put, just is working together as a team to meet a common goal.
Melissa has been the driving force behind our new stroke unit equivalent care and early supportive discharge program. That program takes the patient's journey from the hospital and bridges it back home with a collaborative team approach.
Just to see the clients and the patients within the hospital and then within their homes, when you do provide that collaborative team approach, they're so thankful for what you have been able to bring to them.
Melissa's taught me a lot about what it really means to be a rural healthcare practitioner, and you really do have to work collaboratively, not just within walls of the hospital, but also to support the other rural practitioners in our area.
Rick's collaboration has impacted patient care in the fact that whenever he does work within our team, he is considerate of the constraints of the departments, the fiscal resources of the departments, and tries to be respectful of what the patient needs are, number one, staff needs are, number two.
I guess in everyday work with the clients we work with, our users, we're dealing with managers, we're dealing with supervisors, we're dealing with other departments to make things happen, from IT to housekeeping to telecommunications. So it's a whole group of people that we work with is to make the collaboration part of what we do.
And so when he goes to a meeting to talk about office moves or space planning, he works with both the managers and the end users to make that both are happy.
Shauna Sharoon demonstrates collaboration every day. She's a LPN, she works in CSR, she does our DNA testing. Anytime I phone her to pick up a shift, if I'm doing rotation, she gives up vacation, comes in and works for us. She bends over backwards to help the building, and she's just all around a good person.
To demonstrate collaboration at work is more of actually working with people, being able to do hands-on with your staff, helping the patients out.
All the nurses get along with her. She's always a team leader. She's great with the patients.
I also work at another Covenant Health facility, which is Mary Immaculate Hospital in Mandera, and try to do 1 to 2 shifts a month there to help out as well. What gets me motivated to come to work is to be with my second family. You have a family at home, but when you come to work, it seems like you get to know the staff even more. To be with the people you work with and enjoy your work makes a difference as well.
Collaboration to me means working together, with teamwork and also building those relationships with everyone.
Tammy's collaboration certainly impacted patient care. One day, the emergency department was very, very busy. Our volumes were very high, our capacity was well over 100%. And we had a patient's wife, and she came down to us. She was a cancer patient and needed a specific type of treatment, and I began making phone calls to see if I could find some help. And one of my phone calls was to Tammy, who was equally busy. We were able to successfully find care for this woman.
At the end of the day, we're working together for that common goal, and that common goal is our patient.
She's always willing to jump in with whatever you need help with. We do have our own separate assignments here, but she's always the one that's walking over to see where you're at or if you need help with anything, and she's just always there for everybody. No matter what your designation is or who you are, she's ready there to help you.
So you have to have a willingness first to work with other people. You have to have a willingness to have a positive attitude so that you can work with others, and just, you know, the diversity of people. It's to cooperate for a common goal.
She goes and does all her rounds, and she's looking in and out of everybody's room and seeing who needs help, and even to visit. She'll go around and just visit everybody and see how everybody is, where everybody's at, and that's what makes it such a nice place, right? She's willing to go the extra mile for everybody, residents and staff.